Hi, I'm just in the process of giving you an insight into um, what I've experienced in the last year. Um, I had an operation in October, November last year, um, where I had like a lot of stomach pain, and went to the hospital, and I had bleeding when I went to the toilet, and well, actually, I had it abroad. I came home and it continued. So I went to the hospital, and after them doing some tests, they realized that the colon went over itself, and they needed to do an operation straight away. So within 2 hours, they gave me the lowdown that I was going to get a stoma, and they're going to take part of the colon out, remove part of the colon. There was a risk that it will get perforated, so that was done. Woke up with a stoma, and quite a bit of pain, and I just want to do this video. I'm not really good at this. I've not done it before, but I'm hoping that the information I give, because I had limited information when I was trying to find out about stomas, and especially stoma reversal. Now, I'm just the stoma operation, I didn't really take much notes, but I've remembered some stuff, so which I want to mention. But stoma reversal, I actually did make some notes, so I'll go through that as well, and I'm hoping that that will benefit some people who are going to be undergoing these operations. Right, for the stoma operation, that was the main one, and I spent 2.5 weeks in hospital. That involved I had soreness around the skin. I've got very sensitive skin, so I had quite a bit of soreness around there, and the nurses were really good. They gave me like a belt to put around my waist, and that helped ease some of the pressure, especially when eventually, your stools come out, which is your, the waste that comes out. So she gave me a belt to go around the waist. In terms of the bags and other appliances, I am sure that the nurse that will be supporting you will give you a lot of advice and help in which bags are suitable for you. You might need to experiment with 1 or 2 different bags. For me, the first bag that was used, I had an allergy to it because my skin is very sensitive. And then the nurses changed to a different bag which was better. And later on, about a month later, I actually had a rash around the stoma, and the nurse gave me one of these rings that I will leave information in the description. And these rings were brilliant because they're like plasticine, and I just carefully put it around the stoma and then put the bag on top, and that sealed the connection, and also prevented me from getting a rash around there. I was also given like a powder if it did get sore, which it did a couple of times. You get a bit of bleeding maybe when you take the bag off. I mean, I had an adhesive remover, but this bleeding, I just used this powder and it just absorbed all the fluid. And then I put the bag over the top, and within a couple of days it kind of like healed the skin. I'll also put that in the description. But there's so many appliances. The nurses will give you advice, and look up, do a bit of research and look up the different appliances. Right. The main problem you have with the stoma operation and the reversal, but it's less so with the reversal, but with the stoma operation, it's called ileus, which is where your bowels go to sleep. So once you come out of the operation, they don't function. It could be a few days, it could last a week, it varies, but the bowel doesn't work, and this is the period of time which you could have a bit of discomfort. And there's advice that I will give in terms of that. Right, I don't want to go too technical in terms of after the operation, what I had. I'll just tell you basically that I had a morphine drip for pain relief. You like morphine. I had like a local anesthetic near the stoma area, which they kept in there for like 4 or 5 days, and that gave me relief of pain around the stoma area and the abdomen. And I had like a catheter because I couldn't go to the toilet. And I think that's it really. And a drain, which like took liquid out for a few days, and then they took that out. Now the ileus thing, which I talked about, as far as the bowels not working for a while, what that does is when the consultant does tell you to eat, after a few days he told me to eat, the stomach produces like bile, which is like green stuff, and that's got nowhere to go because your bowels ain't functioning, and too much of that leads to it coming out, regurgitating. It comes out because there's nowhere else for it to go. And so I didn't really, I had something like Rice Krispies to eat after a couple of days, but that caused more discomfort for me. And then eventually I started being sick with like green bile coming out. It was awful, but it's normal apparently. So I got used to it for a few days because, like I said, of the functioning of the bowel. But because of this bile coming out and causing me to cough a lot, it prevented me from sleeping. And so what they do is they stick a nasogastro tube through your nose to the back of the throat. And what that does, whenever there's too much of that green bile that builds up, the nurses can just drain it, and it's so good. It feels a bit discomfort in your throat, but compared to another guy who didn't have it done, he was just coughing and spluttering, vomiting all night. Whereas I did get coughing here and there, but it wasn't as bad due to this tube. I wasn't keen on having it, but I had to have it. Yeah, my son told me to do it, and it did give you some comfort there. And that's essentially what happened for about a week. I think it was about 5-6 days before my bowels started working again. And so I didn't really eat much and drank very little, so I was on drip, hence why I was in the hospital for 2.5 weeks. it took a while for the bowels to work, and then the nurses came, taught me how to use the bag, and the physiotherapist came to help me walk. Although one of the pieces of advice I would give is to walk early, as much as you can. I tried getting up as early as I can. I think it's second or third, well, actually fourth day or something, I started to walk a little bit, and then I just kept walking as much as I could. But luckily for me, I mean, this is another section, I might as well do that now, is the fact that what I did coincidentally, because this was an emergency operation in October last year, and what I did before that was I went to gym regularly, and I actually built my core muscles. I was doing that anyway with like going to gym classes and just generally, and thankfully for that it helped with my recovery. And so I would, and speaking to people, that was one of the advice that they gave if you are planned to have a stoma surgery, then please, do pelvic floor exercises, which they definitely recommend. You can find it on Google, these pelvic floor exercises, or YouTube, and do other exercises to build your core. Because trust me, once you have the operation, the recovery is a lot quicker. And then if you're able to walk, your ileus will start working a lot quicker. Your colon, your bowel will start working a lot quicker if you're mobile. And then constipation is it helps with constipation with you being mobile. So there's a lot of factors in it. And I had a quick recovery, relatively speaking, because I had this strong core. So I would definitely recommend that pre-stoma surgery, and even for stoma reversal, which I will talk about later. A quick note on the bags. Colostomy bags, generally speaking, are closed bags. So when it fills up, you take it off and put a new one on, generally speaking. And if you have an ileostomy, which is a bit more liquidy, they're usually open bags where you can drain the waste, and reseal it. However, I actually requested from the nurses to have an open bag, because mine was in between, to be honest, and it was easier for me to just drain it out. But the choices are yours. Obviously, speak to the nurses and they'll give you more advice, but it worked for me to have an open bag, so I didn't have to change the bag all the time, especially for my sensitive skin as well. To take it off, put it on, take it off, put it on at times, because colostomies generally are a bit thicker, whereas ileostomies are thinner. But I didn't want to change it too often, so I just used the drainage system where you just drain it, and I used to replace the bag every other day if I could. But again, it's how you want to do it. But I thought that was an important thing. It's up to you, and there are flexibility, you decide. In terms of driving a car, I actually, they say in the UK anyway, that if you can do an emergency brake, then you can drive the car, and it's usually, they recommend like after 2 to 3 weeks. And that's exactly when I was able to drive. I think third week I began to drive the car. I felt comfortable sitting in the car and being able to drive without discomfort in my stomach, and putting the seatbelt around. So That gives you an idea of driving. In terms of exercise, I mean, I started walking after, like I told you, about a week and a half. I started walking slowly, and just built myself up. Gym and swimming. No, sorry, gym and just general exercise and stuff. That they don't recommend doing heavy lifting. I took it on the safe side. I didn't do any heavy lifting for like 6-7 weeks. And heavy lifting to me, I mean, I'm not gonna do like really heavy lifting, like over 10 kgs or something, but I was able to do 5-10 kgs, and just if there was anything there, I'd rather do light and frequent than do heavy lifting, if you know what I mean, where you had to strain. Personally speaking, I didn't do that at all for like over 4 or 5 months. But it's your choice. The chances of you getting issues is quite high, and I just wanted to play it safe. You can get hernias, and these are the main complications. Or your stitches can, like internally can open up, especially in the early days, early few weeks. So I didn't lift much at all for first few 3-4 weeks, 2-3 weeks. Thankfully my family helped me out. But in terms of, like doing just a little bit of weights just to tone the muscles, because I wasn't using them, I only did 5-10 kgs after about 2 months. Again, choice is yours, but I just want to be cautious. Now I'm just going to give you a bit of general advice on various aspects of the stoma surgery, and then we'll move on to stoma reversal. Like, I had a colostomy, and so the key thing with colostomy and ileostomy is having a blockage, and that could be very painful if you get proper constipation. I think I had it once, and it was quite painful. I was given sachets, Movicol sachets, that soften the stools. I don't know what the chemical is in it, but it softens the stools, and I took them like every day for at least a month, because I'm just scared of constipation anyway. I used to have it in the past, and so I would just take them every day to just give me a bit of reassurance. Again, it's down to you, but I did have constipation once or twice, and it's quite painful when you've got the stoma there. But thankfully, it was relieved with these sachets that I used to take every day. So I would definitely recommend it. Take the sachets if you are prone to constipation. Secondly, drink plenty of fluid. So when you're allowed to eat, chew the food as if you're going to chew it to give it to a baby. Chew the food a lot. Keep chewing. It helps, trust me. People say this, and it definitely helps it go through the system. Chew the food. Drink plenty of fluid, at least 8-10 glasses a day. Drink, and that should hopefully help prevent blockages. I had low fiber for at least 3 weeks. Low fiber food, mainly white bread, white pasta. So you're not having wholemeal or nuts. So there's the diet, the nurses can give you advice, and there's plenty of advice on the internet. But these are the key things I'm telling you in terms of, don't have wholemeal, or don't, have low fiber diet. Even like vegetables and things like that, fruit, I wouldn't have for the first few weeks. The other thing that might help with the diet is try to have probiotic food, such as Greek yogurt is very good. and you can get other probiotic little drinks that might help your stomach, settle in. So I would definitely recommend that. And just experiment with different foods. So what I would recommend is when you are allowed to, or when you feel comfortable to expand on your food intake after 2-3 weeks, just try one new food a day, and that will give you an idea of whether that food agrees with you or not. If it does, great, you carry on having it. If it doesn't, just keep it off the diet for at least 6 to 8 weeks and just keep experimenting. That's all I did. If there was something that I really wanted, like I wanted a curry, like it's like a yogurt based curry, and I think I had that after the 4th week or something. But I was so needing something with a bit of taste that I tried it, in the 4th week. I got a bit of bloating for like 2 hours, and then it just eased off a bit. Well, I had it bloating I've had for a while. That was really bad, but it kind of like eased off, but it was well worth it. Again, like I said, experiment with the food, and then if it's really bad, just stop taking it. Just have small amounts first. Remember, try to eat small amounts frequently rather than having 2-3 large meals. That is very important. You got to remember your bowels are just starting to kick in again after the operation, and they don't like being messed about. So, it will take a bit of time for it to go back to normal. So, just have small meals and give it less pressure, and just eat frequently. Drink a lot, like I said, and you'll be fine. Early on, eat plenty of proteins like chicken and carbs. Like I used to have like white bread quite a bit, or pasta or something, and that will provide the energy that you need, and also the protein will help in the healing. So I try to consume as much. Soon as after 2-3 weeks that stomach a little bit settled, I would eat more chicken and eggs and things. Although I still get bloating, but it helps with the healing. So I'll definitely recommend that. And, be patient with yourself. You've gone through a big operation. It's not something small. For me, they actually cut me, it was a big cut from my belly button all the way down because it was an emergency. And so you can have your good days and you can have your bad days. But trust me, as time goes on, you'll see the light. You'll see the light. Some people might not notice much and the recovery will be great. Others might suffer a bit more. But trust me, it works itself out at the end. I lost quite a lot of weight because I didn't eat much at the beginning. And then I just gained it back. So I wouldn't worry about energy and all the rest of the stuff. Just look after yourself and make sure you eat properly, and then keep walking, because walking out everything, the earlier you walk, it will help in all sorts of ways. It will help with the ileus. It will help with healing. It will help with your bowels. It'll help with constipation. So out of everything, walking you must do as early as you can. Right, thanks. That's for the stoma side. Like I said, I didn't do a diary, so it's all what I could remember. And some of these points will come up in the stoma reversal as well. But I've actually got a day-to-day, which that's what I'm going to be doing next, hopefully. Thanks. Hi. What I forgot to mention in the previous video was that you get sent home with 28 days. Well, from the start of the operation, you have these blood thinning injections for 28 days. It's like a course, and make sure you complete that. It's good so you don't get any clots or anything. So I had that done. Right, talking about stoma reversal now. This, luckily for me, I did it privately because the amount of time for me to get this done was like nearly 2 years, 1.5 years it would have taken me, possibly, they were saying. And I was low priority, so after 6 months, I decided to get the reversal done. And that was April this year, end of April this year, 2025. I got the operation done, and now I'm actually in recovery mode. It's August. So I'll go through now what the stoma reversal involved for me. I took a video or two, but I don't really want to show you that because I was in the right state. Unless I get enough requests for it, I don't want to show the video. I only took one video anyway, to be honest, and maybe a picture or two, but I did keep a log of what I felt and experienced throughout, though, and that's what I want to go through now. The pieces of advice that I gave you for the stoma side, most of it applies here as well. So I will probably mention them, but I'm not going to go into too much detail. That was in the previous section that I did. As I told you before, I've got quite a lot of sensitive skin. I've got sensitive skin, so I was so relieved that the bag was taken off. The skin around the stoma was quite numb anyway. I think I had oversensitization. I can just feel it now 2-3 months after. But initially, I couldn't really feel much. What it started with for me, it might be different in a different country, but for me, they actually did a colonoscopy where they stick a camera. They stuck a camera inside the stoma and from the bottom, and they checked the colon to make sure that it was healed. So that was the first appointment I got. I had that done first, and that was fine. And then they moved on to the operation. Now the operation, I came out of the operation in quite a bit of pain. Pain tolerance is quite good normally, but it depends on the anesthetic person. And anyway, I was in a lot of pain, so it took about a couple of hours for them to manage the pain for me. But I was in the hospital with oxycodone, which is like morphine. I had a drain, I had a catheter, I had local anesthetic around the area again like I had before. So the setup was virtually the same. I didn't have a drip, but the setup was virtually the same as what I had when I had the stoma done. And the stoma was done in NHS hospital. Great service, great staff, really looked after me. I can't say anything negative about the NHS staff. It was done in St. James Hospital in Leeds, but they were absolutely brilliant. People talk about the NHS going downhill and all that, maybe in routine things, I don't know, but I'm telling you this, the way they looked after me in the operation, I can't say anything against them. They were brilliant. So I had that done, but here, this is a private one, so when I had the operation, the first day I had loads of bloating, loads of burping, standard. It's going to be standard symptoms you'll have in recovery. Again, they went into the same cut that I had from the stoma operation in October, and it's a long cut along down my belly. So there's a lot of healing to be done, and hence, and the burping and the gas, it was quite a bit bloating. The first day I had a physio come down, and they tried to get me off the bed, but I just was so motivated to get on my feet and do something. The quicker you get onto your feet, like I told you before, the better it is for you. So I did struggle. It was a lot of pain around my abdomen. But what I did do was I managed to get off onto the edge of the bed and then get back into bed. So the physio was quite happy with that. Like I said, there's a lot of discomfort, but I did it. The consultant on the first day said I could eat pretty much anything I want, right? Now, the ileus, where the colon again goes into sleep, happened again, like after the operation. But he told me I could eat, so I ended up eating Rice Krispies and jacket potato. Man, I suffered straight after that. It was bloating, feeling sick. So if they tell you don't do it, don't do it for. Personally speaking, if you have to eat light. I think I just got carried away, thinking I could eat normal. I had a full jacket potato and a full bowl of Rice Krispies. Eat light or don't eat at all for a day or two. Let your stomach rest a bit, and especially if you've got the ileus, it's probably better that you just stick to fluids until your bowel kicks in again. And the way you find out is if you break wind, that's an indication that your bowels are starting to work again. I forgot to mention that before, but that's the key thing. If you break wind, that your bowels are starting to function again slowly. So I suffered that quite badly with bloatiness and stuff. And then after that, I didn't really eat much. Day 2, I had pain quite a bit in the night, and I had some more morphine, but I was trying to avoid morphine. And the reason being is morphine and morphine-related painkillers can give you constipation. And so, the staff were telling me I can have as much morphine and oxycodone initially, and then morphine as I wanted. But I only had that when I was in severe pain. Otherwise, I would just stick with paracetamol, or I didn't eat any painkillers. I was a bit of a rebel in that way. I didn't want to eat any painkillers that would cause me constipation, because my priority in my head was I wanted the bowel to start working. But choice is yours. If you're in a lot of pain, take the painkillers. And then, they were saying they'll deal with it afterwards, but I still didn't. I didn't really take any painkillers for. After the first couple of days, I actually cut down on the Oromorph and just stuck to paracetamol. The indigestion and the burping continued. They actually gave me some capsules to help with the acidity. That helped. Well, actually, they put it in the drip. It's called lansoprazole, which is like reduces acidity, and that helped a bit. So I got them to do that a couple of more times, I think, lansoprazole. I was sick twice on day 2, and that green stuff coming out, which I mentioned in the stoma video, that started happening again, where after a couple of times, then I had projectile vomiting in the night, where it just all like came out. It was quite bad. Maybe that was all the breakfast I had the first day. So unfortunately for me, they decided that they were going to put a nasogastro tube again, like they did with the stoma operation, and they stick a tube up your nose and it goes down to the back of your throat, and that eased, then they're able to drain that green stuff, the bile out, and it prevented you from coughing and vomiting as much. So I would definitely recommend it. It's a bit discomfort when they put it in, but once it's in there, then it definitely relieves it. When you get the tightness, you just tell them and they just drain it out. So my son recommended that, and it actually worked. So I had the nasogastro tube put in the second day. So Monday I did the operation. Tuesday they put the nasogastro tube in. And day 4, I actually went out on a wheelchair to get fresh air, because staying in the ward, man, I was getting depressed. Same happened with the stoma thing. My brothers took me out into fresh air, which definitely helps your psyche. So as soon as you can, if there is anybody there that can take you out, and the nurses allow it, they were really good again. The nurses, it wasn't really their policy to some extent, but they actually did an exception for me, because and it helped. So I went out, got fresh air, which was absolutely brilliant. And if you can do it, I would do it. Just gets you out of the ward and makes you feel positive. On day 4, so Thursday, was the first time I actually broke wind. So I had an inkling then that my bowels are starting to work, which is great. The bloating and the wind and all that continued to, I think, the 4th or 5th week. So I'm not going to keep mentioning it all the time, but it was sometimes worse for me at night. Some people might not get these symptoms at all, but for me it was quite worse. The bloating and the burping and all that. I mean, it kept me up. I mean, I had 3, 4, 5 hours sleep. Early on it was less, because I had to get up, start walking, and rub my chest to relieve some of the pain, some of the wind. So I burped and stuff, and then it felt a bit better. So I had that all the way through. It was quite bad, to be honest. On and off days after a couple of weeks, but certain things, then after that, it was down to the food. Some things made it a bit worse, certain things didn't. But you'll get that on and off for 4 or 5 weeks. Some people will, some people won't be aware of it. Again, it wasn't, at the end of the day, like I said, you've had a lot of things, and this definitely helps. Eventually it'll go away. Day 5, it was a Friday, positive day. This was the day. So this is the 5th day, and they took the tube out from my nose, which was fantastic. They took the drain out from one part of my stomach where all the fluid was coming out, where the operation happened. They had a drainage tube. They took that out. They took my catheter out, which I had, because obviously initially I was immobile, so they had a catheter, and then they took that out. So you become a bit more independent and free to be able to go to the toilet. Otherwise you're lugging all these things around with you. So that was quite a bit of relief on the Friday. And also on the Friday, so this is the 5th day, they actually took the dressing off, and took the packing out, which had quite a long piece of materials they stick in the hole where the stoma is. They took that out, which is quite long, what they had packed in there. When you're in the operation theatre, they just, stick it in, a lot of it, because you can't feel any pain. But after that, like when I had these dressings changed, they put it in nice and carefully and until it was comfortable for you. So I had these dressings changed every other day to prevent infection, and to pack so that it heals from inside out. That's the whole point of the packing. So the hole where the stoma was, it was, quite deep, and so they just pack it with this material to prevent it from healing from outside, and it just heals from inside and comes out. It's amazing how they do it, but I had that changed every other day. On Friday, I went to toilet 3-4 times, so I broke wind on the Thursday, and Friday, actually, eventually, I went to the toilet. It started with green stuff coming out, and then it normally went to normal color. And bloating I went throughout the night. Then on Saturday, I actually managed to pass urine because it was a bit difficult with the catheter taken out to do number one, passing urine. But I managed to do it on the Saturday. My bowel unfortunately stopped again on the Saturday, so I got bloating again. I drank plenty, and had those sachets. I had projectile vomiting on that Saturday as well with a bit of green stuff, which proper worried me, considering the nasal tube is out now. But it was just a one-off. So I did ring the hospital up, and they said, look, just if it happens again, let them know. But I didn't get it again, so it was just a one-off. So you might get it again. And what the hospital said is if it happens 2 times or 3 times, then it's of concern. There might be a blockage there or something. So that's something to bear in mind. After a period of time, if you had the tube, or after a period of time, if you start getting vomiting again, that's a sign usually of a blockage, in which case you need to see the hospital or doctors, or go to A&E, and they'll deal with it. And then from there onwards, Sunday, I started to eat a little bit more. This is end of the week now. Is it end of week 1? I still ate just like Weetabix, and a little bit of mash and a little bit of white toast, and that's it throughout the day, and a bit of egg, what I could tolerate. So I was eating little bits all through the day. That was a Sunday. So that was week 1 done. I carried on the next week just by getting the dressings changed, eating a bit more. I had to have 2 Movicol sachets because I was a bit blocked, and that helped. The next day I actually went to the toilet, and then throughout the week I was eating a bit more, and number 2 came out a little bit, on Wednesday it came out a little bit. And so it's on and off. I went 3 or 4 times on the first week, on the Friday or Saturday, and then I didn't really go much until like Monday, Tuesday or something. I didn't eat much as well, so I was just being a bit cautious. I wouldn't eat as much, and hence, expected to go to the toilet, but I was still worried. I was all OCD on becoming constipated. But if you don't eat, nothing much is going to come out. But I went toilet on Wednesday, and this was the story for the next 2-3 weeks, to be honest. What I started getting in middle of the second week is I started getting pain in my lower back, and I believe that was to do with not using my muscles and not really moving much. And so every evening I had to get a hot water bottle and put it on my back, and that helped relieve the pain a bit. This happened for another couple of weeks, I think, after that. So middle of the second week, and then a week or two after, this happened on and off, where I would get the back pain, especially in the evening. I would use hot water bottles, and that gave me a bit of relief. Got my son to massage the back at times, and I had a better sleep then. So that might just be me, I don't know, but I think it was weakness of the muscles. But if you do get it, then use a hot water bottle. On the Friday, so this is week 2. On the Friday, they actually took the staples out of the main area which they cut. They're quite easy when they take them out. There's some that just nip you a little bit, but you don't get any pain really that much. And they used to dress the part which was cut, as well as the stoma area, as well as the drain area. So that I used to have 3 dressings on. This says don't make them wet, so they're a little bit waterproof, not that much. So showering was an issue, and so you can use a cloth bath if you need to. And then when I used to be in my dressing appointment, about an hour before the dressing appointment, or hour and a half before, I used to have a shower, and then I used to just go to and try to prevent as much water as I can on the dressings, and then I'll get the dressing changed anyway. And I should just tell them that I just had a shower about 1.5 hours before, and that seemed okay. But again, check that with your doctors or your nurses whether you're able to do that, but it was okay with me. You can put like food wrapping plastic around your body and then have a quick shower. Try not to get as much wet, but you get a little bit wet, doesn't really matter. So you could try that if you want, just to cover the dressings, and then have a shower if if you really need it, if you're in a hot country or something. But that was an issue for me. But this is what I did. Like I says, I had an appointment every other day, and that's what I would do. Hope I'm not talking too fast. Yeah, so I in second week, after I started eating a bit more, experimenting with the food a bit at the end of the second week, and that seemed okay. Light food, and with thinner consistency, and chew as much as you can. I told you all this advice before. Chew and drink plenty of water. I ate more chicken then. I didn't eat as chicken in the first week and a half, but I started eating chicken more, with bread and like sandwiches or whatever you can do, but chew a lot, as much as you can. And then end of week 3. So then the whole week after that, it was just normal routine of getting the dressings changed and the bloating and dealing with it. There wasn't much else in there. But end of week 3, I stopped. The nurses took the dressing off from where the cut was, and I didn't need it anymore after that. And the drain was virtually healed at that time. I think week 4, they stopped using the drain dressings as well. So they just left it open. It kind of like healed. It kind of like healed up when it was dry. So they didn't use the dressings then. A week after, they stopped the dressing on the drain. So the only dressing I had was the stoma with the hole where they did the packing and they put the dressings on, and did that every 2-3 days. Also in the 4th week, the stoma, the dressings sometimes get filled with a bit of blood, but don't be scared of it. That's just normal. I was at first. I saw loads of blood, but then I tried to do stretches and things. I think that made it a bit worse for me in the 4th week. I shouldn't have done that. I'm being an idiot. So I wouldn't do any stretches too much. On my stomach, I was trying to do like crunches and stuff, something like that. I can't remember. But, be sensible. But you might get a bit of blood there. It's not a big deal. They just cleaned it and just kept packing it, and it was fine, until the end. Swelling of the abdomen came down in the 4th week, and I began walking 15 to 30 minutes. This was in the 4th week, so the recovery was a bit longer for me with the stoma reversal than when I had the stoma done. I was walking a lot earlier, but with the stoma reversal, it took me a bit more time to walk because the area around it was quite sore for me, and it was a bit difficult to walk. The abdomen was a bit bloated, but I managed to walk a bit longer, 15 to 30 minutes in the 4th week, and then I started building that up throughout the rest of the time. 5th week, right in the 5th week, I still had bloating after eating, but it started to ease off. I managed to drive the car for 20 minutes. So like I told you before, you should be able to do an emergency brake in UK for you to be able to drive, and it was a bit harder for me to sit in the car, and so it took me like 5 weeks to actually comfortably sit in the car, and then I drove for 20 minutes, so that was good. Had a bit of independence. I had the dressing change, and they actually measured in the 5th week the stoma, the depth, and it was 1.9 centimeters, whereas the week before it was 2.3 centimeters. So it started to heal quite quickly now in the 5th week. I had like a bit of hemorrhoids, but that eased off after a bit. I think it was because of sitting too much and sitting on the toilet. So definitely don't do that for too long. If you can't go, you can't go. Just get up after a few minutes and try again later. I used to get a lot of false things where I felt like I needed to go. This happened with the stoma as well. Sorry, not with the stoma here. And then you just go, and then eventually it's wind or something. So, but you get used to that eventually. And the other thing is retraining your bowels to function again. I forgot to mention that. That was a very key point, is retraining, because sometimes you can't control it and you feel it. You want to go and you can't open your bowels. That took me about 3 weeks as well, 3 to 4 weeks to proper get used to it. So it's really weird, but you're not able to there's two muscles, one on outside, one on the inside, and you have to control both of them to be able to be able to go to the toilet, do number 2. And so that takes a bit of time. Naturally it'll come, you'll see the light, and just bear with it. And I think after the 7th or 8th week, the stoma was virtually healed. Right, this part I'm just going to give you some advice on what sort of things are important to have, and just a summary of the important things that you need to know for either the stoma or stoma reversal. They usually apply for both. As far as what things to have with you, I would definitely say you'll need especially if you had ileostomy, and like a reversal, you definitely need Sudocrem pads or pants. Sudocrem is like a barrier cream. I don't know if you're in a different country what sort of cream it is, but it's like a barrier cream that you'd use on babies' bottoms. So because you might have to go to the toilet frequently, which I did early on as well at times, and it just made the bottom a bit sore. And these creams definitely a lifesaver. So I would recommend having them with you. What they usually recommend after a bowel movement is to wash it with warm water to clean it, and then pat it dry carefully. Don't use like toilet paper initially, and then put the cream on. Later on, after a few weeks, you can use like wipes, and Vaseline is quite good as well to use to protect it. That's like with going to the toilet quite frequently. Excessive wind was a big problem for me. I did have peppermint tea, which definitely helped. Peppermint tea quite frequently I had. Or like you can get capsules with peppermint in, and they just help with the bloating here and there. So that definitely helped. I would, if you prefer tea, just have that. Also, there's certain foods that give you wind, so try to avoid them early, and hence why it's a low fiber diet. And things like vegetables and fruit, even for low fiber, I wouldn't have. Look at it. Look at the diet. Look on the internet what you can have and what you can't. That's important. And listen to the nurse. If you've got a dietitian, listen to them and what they say you can have and avoid. Especially in the early first few weeks, I would definitely stick to that. Large fatty meals, I'll give you a summary. Vegetables such as cabbage and onions, alcohol, fizzy drinks, just try avoiding all of them because they'll just cause you issues. And like I said, I got for constipation, I got sachets, and I just took them every day in the evening. You can take them 2-3 times a day if you are prone to it. Just see how it goes. If you don't go one day, then the next day just make sure you increase it so you don't get a blockage and you don't suffer. Definitely drink plenty of water and trial and error with the foods. Just try one food thing. I know I'm repeating it, but these are the most important parts of, I believe, the reversal. And even when you're having the stoma, in terms of the food and drink, you have to have the low fiber diet and just gradually get into your normal diet and be sensible. Hernias definitely was my other worry, to get a hernia. And so to prevent that, hernias, because they've gone into your stomach, the chances are that, your stomach wall is quite weak, and the last thing you want is for organs to come through there, and then it'll give you discomfort and pain. So don't, lift heavy, especially first few weeks, and then later on, 6 to 8 weeks later, if you need to go to the gym, just do light weights and do more frequently. I would definitely recommend that. And that's it. I hope everything goes well for you, and I hope you don't get most of the symptoms that I had. If you want to comment below on whether any of these symptoms apply to you, or you had it easy, that'll be interesting. It'll be good to know your progress, and I hope it goes really well. I mean, the stoma reversal, I was reading up that some people decide not to have it. That's fair enough. Like if you've had issues with your bottom and, like other indigestion or whatever problems and stuff, that's fair enough. you make your own choices, informed choices. But for me, I still got like a lump because they took part of my colon out, and so it's gone over one of the organs, and so I've got like a lump. I thought it was a hernia, which worried me, but it's not. It's just the colon that's gone over. But thanks to God, like I've become a bit more independent. And yeah, feel good. I'm going back to sports in a few months' time, and then just go back to normal life. If you've got any questions about it, please put them underneath, and I will definitely get back to you on it, and give you answers to whatever I can. Yeah, all right. Thank you very much. Bye.